let us talk about the common medical issues that can arise during pregnancy. I am Dr.Surekha.A, consultant obstetrician and gynecologist at Apoorva Center for Maternity Care, which is located at Medipally. Most of the time, 85% of the women do not have any medical issues. In about 10 to 15% of women, one or more of these issues can occur. So we need to be aware of the signs and symptoms in order to identify that this is something different and I need to go to my doctor now, is what we should all know and act upon. So this is the idea of this video. Many women have a small percentage or a small degree of nausea and vomiting during pregnancy. This is quite common, but in a small percentage, I would say about 3 to 5%, they have a very high gradient of this problem of vomiting. They vomit several times in a day. They feel very nauseous, unable to eat anything. So this is called hyperemesis gravidarum. So this can be because of the hypersensitivity to the hormones of pregnancy, and we need to address this issue. Otherwise, the women drastically loses weight and fails to provide enough nourishment to the baby. Not only that, there can be other problems that can arise to the mother as well. So in order to tackle with this problem, you need to know that there is an issue, contact the doctor, wherein they will give you multiple set of antiemetics. They will give you IV fluids, supplement you with the right type of IV fluid, and also give you vitamin supplements and injectables, and rule out problems that are causing this issue. It might not just be a simple pregnancy. It could probably be something called as a vesicular mole, which needs to be ruled out, or it could be a twin pregnancy as well. So this is the first of the issues I wanted to discuss today. Going on into the second trimester, usually from the 5th month onwards, sometimes women can have high blood pressure readings. So when the woman notices that she has swelling of her feet, or when she's complaining of a headache, or to a higher extent it could be something like a nausea, vomiting, or a blurring of vision, and her BP recordings at the same time are high, usually above 140/90 or more, that is when we need to be alert and then visit the emergency room and inform the doctor of these issues. And these are more likely to happen at extremes of age of pregnancy, or if we have a genetic inheritance or any immunological disorders, these predispose the women to have these complications. All women are usually screened for diabetes between 24 to 28 weeks of pregnancy by doing the oral glucose tolerance test. Asian population women are at a risk of having diabetes mellitus. So it is very important to screen all antenatal women between 24 to 28 weeks, and by 16 weeks if they have a strong family history of diabetes, or if they have any other factors like, for example, a previous IUFT, a previous large for gestational age baby, a baby which is more than 4 kg weight, this marriage, and the husband is husband has diabetes. These are the factors where we need to screen the woman at 16 weeks of pregnancy itself. So once the oral glucose tolerance parameters are deranged, even one of them, we are labeled as gestational diabetic for that particular pregnancy. Most of the time the diabetes is stabilized after birth, but in 1% of women it tends to continue after delivery as well. So when we notice that we are having frequency of urine, we are feeling more hungry, and more thirsty and not being satisfied with what we eat, we need to probably think that, am I developing gestational diabetes? That is the time at which, even though you are not scheduled for the test and you haven't reached the 24 to 28 week period, you need to get the diabetes test done. The other important medical issue that can arise during pregnancy is a urinary tract infection. It can be a lower urinary tract, or sometimes it can even ascend to be an upper urinary tract infection. Very important that all pregnant women are screened in every trimester for urinary tract infections, and therefore avoid any problems to the pregnancy because of a simple thing such as a urinary tract infection. So when woman has these symptoms, she can have a lower abdominal pain, burning sensation while voiding, or frequency of urine, or sometimes even a loin pain, which can indicate that the urinary tract infection has ascended up to the upper urinary system, and it is very important to be taken care of. These are some of the issues that I have highlighted and which commonly occur during pregnancy. And if you have any of these issues, do not hesitate to call us, or you want to know more about them, please do call us at the number given below, and we are always ready to help you. Thank you.